When you need medical help fast, use NHS 111 online to go from home to an urgent treatment centre.
Mr. Williams, please come through.
Or a pharmacy.
Hello, pharmacist will see you now.
Or if needed, stay where you are and get a call from a nurse, doctor, or paramedic. Get assessed and directed to the right place for you in as little as 90 seconds. Use NHS 111 online.
This is Our People podcast telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hi and welcome to Our People podcast. I'm your host, Harry Newhouse, and for today's episode we will be talking to some of our staff from our cardiology department. This week we are celebrating World Heart Day, and here to discuss this and all topics related to the heart is consultant Mickey Jachuck and departmental manager Joanna Spence. Welcome to the podcast, Mickey and Joanna.
Thank you.
Thank you.
Mickey, please could you introduce yourself, explain what your role is here at the Trust and what that involves on a day-to-day basis?
Okay, thanks, Harry. I'm Mickey Jachuck. I'm a consultant cardiologist, and I've been here now for just over 10 years. I guess I have two roles predominantly. One's a clinical role as a cardiologist, and I work with what seems to be an ever-expanding team of other consultant cardiologists, and we provide, obviously, cardiology services across our two acute sites, South Tyneside and Sunderland predominantly, but also some community sites at Grindon Lane and recently Durham Treatment Centre as well. I also have a leadership role as a clinical director, and I look after the cardiology and respiratory medicine teams, and also the clinical microbiology and infectious disease team. It's probably not easy to describe what a clinical director does day to day, but ultimately I guess it sort of involves being sort of the line manager for the medical team and working alongside the directorate manager and matrons to make sure that we're performing well and meeting the Trust's objectives.
Brilliant. And same question to you, Joanna.
Thank you. So I'm Jo Spence. I'm the Senior Chief Physiologist in Cardiology. I'm also Departmental Manager across both sites and for the cath labs. So physiology is one of the disciplines within healthcare science, so that the clinical role itself is very varied in carrying out a number of diagnostic investigations, seeing patients in clinic, lifelong management of patients with things like implantable cardiac devices. And alongside that, obviously within my role, there's a heavy input into the operational management of the departments across the Trust.
Brilliant. And when talking about cardiology, many people recognise that with a heart attack, but you also deal with much more than that, don't you?
As I say, you're right. I think the first thing people think of with cardiology is heart attacks, and certainly sort of, I guess, the sharp end of what we do day to day, and we obviously offer emergency care 24/7 for people who might be having heart attacks. But it's a lot more than that, and I sometimes describe the heart to my patients as being a bit like an engine. Clearly it's the most important part of the body, and I'm sure other specialties might disagree, but just like an engine, it's got different components and different parts of it can go wrong or need repair. So again, I guess a bit like an engine, it's got valves and electrics, so you can have problems with your heart valves being narrowed or leaky that can cause problems. You can have problems with the wiring of the heart that can cause heart rhythm problems. There are various conditions of the heart muscle, and the other thing that we're seeing more and more of now is patients with heart failure. I guess we're a victim of our own success in a way that people are surviving other illnesses that in the past potentially would have been fatal and living longer, and so we're seeing more people with heart failure where the pumping action of the heart doesn't work as well as it should do. And it's not uncommon to see this alongside other conditions as well, so people presenting with multiple problems, one of which being the heart condition, and that often needs a very different approach to management.
And as a consultant, do you deal with anything differently to as what Joe might deal with?
Joe's probably better around saying that. I guess we all deal with the same thing, but from different sort of angles and different sort of areas of focus. So it is important that we work together as a team. It's not just obviously consultants and physiologists, but we've got nurses, pharmacists, and other allied health professionals who all work together.
Yeah, so obviously just adding on to sort of what Mickey says there, the heart does function in a number of ways, and a lot of the diagnostic investigations that we'll do as a multidisciplinary team approach will either perhaps look at the overall function of the heart, or it could look at the electrics, and that would dictate sort of what investigations or what treatment a patient potentially might need under the care of the team.
What's the difference between a heart attack and a cardiac arrest?
So it's a good question, because it's another thing that lots of people often get mixed up. They are two very different things. So a heart attack effectively is when there is a sudden blockage or interruption of blood flow to the heart muscle. That's usually due to a narrowing or blockage in one of the heart arteries, and that's typically presents with chest pain symptoms. Not always, but usually with severe chest pain and changes on the ECG and on troponin, which is a blood test that's very sensitive to picking up signs of strain or damage to the heart. So with prompt diagnosis and treatment, it's eminently treatable, and what we offer is sort of 24/7 angioplasty, which is the procedure where a stent's put into the blocked artery to unblock it, and that works very well, and most people make a full and rapid recovery from it. And so heart attacks these days aren't sort of perhaps as sort of deadly as they used to be not that long ago, and people sort of can carry on living normal lives with the right treatment. A cardiac arrest is a different thing, where the heart effectively just stops, and that can be due to a severe electrical fault. Joe mentioned heart rhythm problems, and there are some potentially dangerous heart rhythms that effectively cause the heart to stop beating, and that's the type that responds well to defibrillation. And the other type of cardiac arrest is when there's a mechanical failure of the heart and it fails to beat properly, and again, resuscitation that's provided probably can be effective, but often not as effective as the other type of cardiac arrest. Now, cardiac arrest can be caused by lots of things, heart attack being one of them, but there are various other things that can cause cardiac arrest. So it's important to recognise that, and also sort of be aware of techniques for resuscitation, because that can make a huge difference to someone's chances of survival.
Cardiovascular disease is the world's #1 killer. How important is it to have days such as World Heart Day to help raise awareness and mobilise action against such diseases?
So I think, from our perspective, I think it's really important that people are obviously very conscious of their own health, aware of the risk factors that would, potentially sort of lead them to have heart problems. And it just gives us an opportunity to promote it, make sure people are aware what to look at, be aware of lifestyle factors, as well as sort of family history that might predispose them to having sort of cardiac disease. It also gives us a good opportunity to, promote the work of the team, particularly within cardiology. And to raise awareness of standards of practice across, say, point of care investigations. So one of the things that we'll be doing alongside obviously sharing the podcast is to doing a promotion around about ECG, which is a very basic point of care investigation that occurs throughout the trust, just to promote the importance of doing that correctly, so that there will be stands across sort of both trusts where staff can ask information to make sure that the point of care investigations are done properly. And also, there'll be interaction with the patients and public in that respect as well.
Is this something you'll do on a regular basis, just outside of World Heart Day?
Absolutely, we do have an ongoing educational programme, and all new starters as part of the trust will be trained how to do ECG, and we particularly target the healthcare assistant workforce, and they all do it as part of the care certificate as well.
How can someone tell if they are at risk of heart problems in the future? Are there any signs?
Yeah, and I think this is one of the important things about being aware of heart disease, and things like World Heart Day and the work that Joe and the team do to sort of promote awareness is important, because there are absolutely things you can do to reduce your risk of having heart problems. And I guess you can broadly separate into things that are modifiable, and you can change things that you can't. So for instance, there are some heart conditions that are inherited and run in families, and clearly there's not much you can do about that if it's a genetic component to it. But being aware of it does make a difference, because again, there are interventions that can be performed or provided that will reduce that risk. But the vast majority of people have very reversible risk factors for heart disease, things like diet, weight, exercise, smoking, that are very or relatively easy to do something about, and can really, really drastically reduce your risk of developing heart problems in future. Sometimes it is easier said than done. We recognise that not everyone will find it easy to stop smoking or modify their diet or start exercising. So I think increasingly now we're sort of recognising that there are ways of supporting people to do that, and promoting healthy lifestyles that way.
What services does the team provide here at the Trust, and when providing things such as investigations?
So the team, like Mickey said before, there's a wide multidisciplinary team, which incorporates medical staff, nurses, radiographers, physiologists, and pharmacy teams. So it is very much a team approach in lots of respects when we're delivering investigations, whether they be in a non-invasive sort of outpatient setting, or whether it be invasive more sort of in the cath lab setting. We do everything from ECGs, which are a basic heart tracing, which looks at the electrical activity of the heart, right the way through to more complex activities such as implantation of cardiac devices. And a lot of the investigations that the patients would have would build up a little bit, like a puzzle, which would help, particularly the consultant team come to a diagnosis and to sort of aid further treatment and management. But for some of our, patients that we see, they're on our books for the duration of their life, particularly, like I mentioned before, the patients who've got implantable cardiac devices. So, you have relationships with a number of our patients for decades, out with doing sort of one-off investigations, which, will quite often be the case as well if somebody presents either acutely as an inpatient in a hospital or, is having a one-off diagnostic investigation, maybe, prior to surgery, just to sort of assess the wellness or the fitness of an aesthetic. So we do a big range of investigations.
Yeah, I think the other thing to mention alongside that is the fact that it's been quite an exciting time for the department over the last few years at least, and certainly since the merger, because one of the things that came out of that in a way was that it allowed us to become a slightly bigger department, obviously as a single team working across both sites, and it gave us sort of a critical mass to allow us to develop further. So we've been trying to develop new services and more specialist services, and one of the things, for example, that we were able to start, I think just over a year ago now, was a cardiac MRI service. Now, this has been something that in the past was regarded as a very highly specialist test, but over the years it's become a very sort of fundamental part of diagnosis for cardiology diseases and management. But certainly for our area across South Tyneside and Sunderland, there wasn't availability or provision for it, and sort of local patients had to travel to places like Newcastle or Middlesbrough to get scans done. So we recognised there was a need for that here, and did a lot of work to try and sort of get approval for a cardiac MRI service locally, which fortunately came about, and I have to give credit to Ali Khan Bandali, who's one of our cardiologists, and his team, who helped do an awful lot of work to get that through. What that means is now our local patients have access to a sort of state-of-the-art test that gives us so much more information that we weren't able to access before, and really just sort of makes a big difference to how we treat and manage people. And alongside that, there's a number of other service developments that we're working on at the moment, and Joe mentioned cardiac devices, and we're starting to implant more specialist devices, more complex devices. We're hoping to start a defibrillator implant service as well soon. So again, these are things that patients locally would have had to travel to other centres for. But now, as a sort of increasingly more established cardiac centre in this patch of the region, I think we've got ambitions to make sure that as much as possible patients should be able to access the cardiology services and care that they need here, rather than having to go to places like potentially Freeman or James Cook. And as much as possible, we'd like to be able to deliver that locally. And
it's amazing over the last couple of years, sort of how technology has developed to ensure patients get better outcomes and better service here at the Trust. Yeah, and I mean, I've heard quite a number of other podcasts that have sort of commented on the changes in technology, and in some ways we're similar to, I guess, radiology and surgery in terms of some of the equipment we use are very similar to what we used in theatres and in radiology, and we've seen the same technological advances in those as well. And again, going back to cardiac devices, the abilities and the diagnostic information now we can get from patients who have devices without them having to come into hospital, because this is all now done wirelessly over remote monitoring. It gives us a completely different way of being able to manage people in their own homes. We also carry out some invasive procedures. What are they and how are they carried out?
Yeah, so we obviously mentioned a range of investigations there before. We also have 3 cath labs across our sites, which is where the highest volume of invasive cardiology investigations are performed. So they would predominantly be things like angiography that would look at the coronary arteries under X-ray guidance, so injecting a dye, and they would sort of show up on the screen, and if there was any abnormalities, any narrowings there, then obviously we can proceed further with that to something called cardiac intervention, where a patient might get a stent placed, which would open up the arteries. there are a number of ways that we can do this. Obviously, would mention cardiac devices. They're also done within that setting as well.
We also have a heart failure nursing service at South Tyneside. Could you explain what the team does to help our patients?
Yeah, I mean, it's not just South Tyneside, it's across the whole area, really. I mean, I mentioned earlier that heart failure is an increasing condition in terms of we're seeing more of it. We're seeing older patients with other conditions with heart failure, and our knowledge and understanding of heart failure is again sort of advanced over recent years. So heart failure can sometimes be quite a scary term for people, and it's a quite broad term that means a lot of different things. There are different types of heart failure. In some forms it can be very serious, life-limiting, and in other forms it can be relatively mild and people can function completely normally. The way that we diagnose and treat heart failure, again, has also changed a lot over the last few years. So some of the tests that we use, it's not just about heart scans like echoes or MRI. There are blood tests and other things that need to be done to get a proper assessment of patients with heart failure. And then the treatment itself is also become more complex. There's different medications, there's different interventions. So to be able to do all of that properly in terms of see, assess, diagnose and treat, it needs quite a sort of complex and multidisciplinary, multi-professional team to be able to do that. And that's what our heart failure nurses really predominantly lead on. So they work very closely, primarily with the patient, but obviously with their GPs, other carers, community teams, with the specialist teams in hospital as well to try and coordinate all of that. We've actually just sort of, well, hopefully concluding a piece of work that's taken probably a couple of years to develop, looking at our heart failure pathway to try and sort of integrate that and have a sort of single gold standard heart failure management pathway across South Tyneside, Sunderland, and actually parts of North Durham, which we provide care for in the community as well, and linking up our acute teams, community teams, and primary care teams. So we've also worked closely with sort of charities as well in terms of supporting patients and making sure they've got the resources to manage their conditions as well.
You've already mentioned some of the reasons of how someone can prevent having heart problems, such as diet, smoking. But can someone's family history also have an effect on someone who's suffering from a heart disease?
Yeah, so there are absolutely some forms of heart disease that are familial and inherited. And I guess, as I say, first point is just recognising that. Now, some people will be very aware if they've got a strong family history of heart trouble, and what we mean by that usually is sort of first degree relatives, parents, brothers or sisters having developed heart problems at a relatively younger age. I always worry about what the definition of younger is, as long as it's younger than me. But that's, I think, sort of the age of around 50, 55 is used as a cut-off. And so people who perhaps develop heart trouble at a younger age are probably more at risk of passing that on. But certainly would need assessment and investigation to see if they've got any particular condition that could be causing that. There are increasingly as well a number of patients who are surviving later on in life with some forms of congenital heart disease that, again, in the past potentially wouldn't have allowed them to live as long. So one of the other things that we're looking at in terms of developing locally is a more of a focused service for that kind of patient who, again, previously would only have been looked after in a very specialist centre like the Freeman, but because there are more and more of these patients now surviving to a later life, that they need to be looked after in again slightly different ways to how we would normally manage sort of the normal types of heart conditions that we see.
If someone does have problems with the heart, can they do any physical activity, or how much physical activity should someone do?
Yes,
Yes is absolutely a simple answer to that, and it's important that people recognise that, because exercise in itself is a really important treatment, and we've talked about how keeping active and exercising can prevent heart problems, but it's also very good treatment. People who are recovering from heart attacks and heart surgery even, and things like that. But for those cases, it's important that they get sort of proper guidance and supervision. That's what our cardiac rehab teams do, and they're excellent at taking people through what they can and can't do and getting back to sort of an active lifestyle again. But yes, I think people should always get advice if they're not sure, because there are some forms of heart disease where you do need to be a little bit more cautious. But in the vast majority of cases, people can go back to sort of being active again. I mean, just look at Christian Eriksen And there's been a number of sort of fairly high-profile cases like that where people have had quite serious cardiac conditions, and professional sports people having sort of cardiac arrests and surviving, who've gone back to being competitive again.
That seems to be happening more and more recently. I don't know if that's because media's a lot bigger and like TV coverage is a lot bigger in sports, that you see it happening more often. But how essential is it for someone to learn CPR? Because I remember when I was watching the game when Christian Eriksen collapsed, and I don't think if the guy didn't start, he was fortunate enough that someone around the stadium knew how to do CPR. So it essentially saved his life. So how important is it just for anyone to learn how to do CPR?
I think it's a really important, essential sort of life skill, really, to be honest. I think it's quite reassuring that it's coming on board to the likes of the school curriculums, because increasing that chance of survival and having people able to deliver life-saving resuscitation, even at a very basic level, it increases somebody's chance of survival. Really, and I think that's, when obviously the footballer that Mickey mentioned, the amount of people that were obviously around and that quick action at the time was really the catalyst to him sort of going back to living a normal and full life, and that, that can quite often happen sort of, every day, you might encounter it when you least expect it. And we do have a number of the team who, within their own time will obviously support training for, clubs, schools, to teach them about resuscitation and CPR. And the likes of the British Heart Foundation have got some really great online sort of programmes, snippets. It doesn't take up too much of your time, but just that awareness of what to do if this situation arises is just paramount, because it does help that chain of survival.
Yeah, and that's obviously, we've seen the high profile cases, but we see it day to day. I mean, obviously, as I say, we provide 24/7 care for heart attacks, and some of those patients come in having collapsed with a cardiac arrest on the street. And it's very evident for those that get very prompt CPR and resuscitation, if it's appropriate, they always do much better than the ones where there's a delay. And so it is important. It's not that difficult to learn. And I guess for sort of staff working in the trust, regardless of whether or not you're working in the cardiac team or if you're in admin or anything, there's sort of, I guess if you're in the public, there's an expectation because you work for the NHS that you know how to do CPR. So I think it is important for people to know. It makes a huge difference. And again, as Joe said, in places where it is sort of more mandatory, the survival rates from cardiac arrest are much, much better.
In the lead up to someone having a heart attack, is there a feeling that someone might feel like in say 10 minutes before it happens, or within an hour before it happens, or is it an instant feeling that?
That's kind of like the classic, isn't it, that you would see, that people, and there can be sometimes precursors to it, but then equally, like that sort of classic, or somebody might get a band across the chest, or it might feel like a crushing pain, or, they might feel dizzy or lightheaded, but then equally you will get the people who will go down without any warning. So there can be, and quite often sometimes if you speak to people, if they make a recovery after the event, they might tell you that they've had some symptoms prior to it occurring, but maybe they didn't give it any merit, or on the flip side they had no warning and they just sort of went down.
That's really interesting to know. And before we end this podcast, I've got to mention finally, Mickey, you took on the Great North Run earlier this month. How did it go?
Yeah, it was last week, I think, wasn't it? Yeah, I'm still recovering.
It was just gone.
The aches and pains. I enjoyed it. I think I'm sure, and I know there was lots of other colleagues in the trust who did it on the day, and I'm sure there was lots of others watching, and there were many at work as well. It was probably one of the strangest Great North runs there've ever been, I think it's fair to say. It was really warm, so I spent most of the run trying to keep cool and pouring water over myself, and then changed into my dry clothes at the finish to make my way home, and then got soaked in the downpour that followed. And I think there were some people that were still running when the rain hit and having to sort of wade through the floods along the coast. But no, it was a great day, and as always, the crowd were fantastic. I have to say, I mean, this is my third in a row now, and I think I've heard a lot of other people say that the crowd this time was even better than it's been before, and I'd personally like to thank everyone who handed out jelly beans and orange segments, and I made the most of the pint at 10 miles as well that I got.
Yeah, my mate ran the race, and I've never known how important the jelly babies were until this year's Great North Run.
Yeah, I don't think I would have finished without them, to be fair.
It's quite heartwarming the amount of people that come out along the route, isn't it? From
It was
the houses,
incredible.
giving you the jelly beans and the,
there were ice pops as well this time, which were definitely
well
needed.
deserved.
And I'd just like to congratulate everyone who ran, all our staff, all our patients who ran this year's race. Did an excellent job. But in 2021, you were one of the 4 NHS official starters of the Great North Run, Mickey. How was that experience?
I mean, that was incredible, and it's something I'll never forget. I mean, it was certainly a huge honour and privilege to be a representative for all our colleagues and staff at South Tyneside and Sunderland. And I mean, people I'm sure will remember it was a bit of a strange time. We were just coming out of I think sort of the first couple of phases of the pandemic and lockdowns, and I think it was one of the first occasions that people were allowed out and be able to get together. So that was quite memorable, and the fact that I think the whole event was sort of a celebration, not just of the NHS staff during the pandemic, but all the key workers that sort of kept the country running, if you like. So it was really sort of unforgettable. I think for me personally, I mean, I'm born and brought up in Newcastle. The Great North Run's something that's iconic, and I've always wanted to do it, just never felt able to. And so again, sort of running was something I sort of took up during lockdown, and not just being able to do the run for the first time, but also being able to start it. That's sort of something that will live with me forever, really. And I don't think there's anything that will make me more proud to be a Geordie, except maybe Newcastle winning the Champions League.
That brings us to the end of this episode. Thank you, Mickey and Joanna, for joining me today.
You're very welcome.
Thank you.
Thanks for joining us for this episode of Our People podcast. We hope you enjoyed it. Check out our other stories. Hit subscribe to keep up with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.